Hello, I am here with Kath Schubach. Kath is a urology nurse practitioner and she is trained in giving men penile injection therapy, which can bring on an erection even when you're not having any erections at all after prostate cancer surgery. Now, Kath has worked in this field for over 20 years. I'm very excited to ask her, Kath, what happens in an appointment with you? If someone books in to be educated on injections, what does that look like?
So, thanks Victoria. So often I have patients that come in for what we call injection therapy, and even though that's what our aim is, again I ask the patients how they're going, and so it's not just about getting straight into we're going to do injections and things. Now they're a bit fearful, and often I haven't met patients, and so I like to get to know you. So we have a little a chat about where you are in your recovery, and then we go into talking about what's involved with injection therapy. Now, as most men are very apprehensive towards using injection therapy or frightened, and that's a very normal process and a very normal feeling, we often go through, I go through about the anatomy and physiology of the penis, how they get erections and what happens, after having prostate surgery or radiotherapy or any other treatment that you've had for your prostate cancer. And then we talk about, it's really about going through, showing them the needle, showing them where they're going to inject on a model, and then we will talk through each phase. We go through the management of priapism, because that's the main side effect of injection therapy, which is a prolonged erection, and we don't want that to happen to patients. And then we talk about, as I said to you, pain. Often men think that a needle hurts, the penis is tender, so it's going to be painful. But actually, there has been some clinical trials done asking patients how to rate their pain. So when they put the injection in, 0 being no pain and 10 being the worst pain in the world, and it's usually around about a 1. Okay, and so really that gives them a little bit of reassurance in regards to that. I think one of the important things to note is that sometimes injection therapy is not for all people, and sometimes there are some patients, a subset of patients, that it doesn't work on. If that's the case, then we can use things in combination. So we may be able to use a vacuum device or a constriction ring or something like that. So we would tailor that to those patients. Now, it's not a lot of patients, but I think it's about dealing with patients' expectations.
Absolutely, expectations are so important, and that everybody does actually have a different journey with this, so getting that tailored advice. And Kathy, you were telling me earlier that sometimes we have in our mind, you can have Trimx or Cavaject, but there's actually so many compounding.
So there's probably around about 15 combinations of penile injections that you can get. So of course Cavaject is alprestadil, and that's pretty much a very common one that can be that patients can get from Chemist Warehouse or things like that. Now you do need a prescription for it, and again it's about. I often say to men that this is a learning process, so it's trial and error, and it may take a number of injections to get the right dose for you. So you don't often have one injection session and you've got that right dose. It can, and for some men that can be a little bit frustrating and a little bit they do get frustrated with it, and so it's about working out and supporting them through that.
Yeah, so it sounds like after they see you for that appointment, there's then this follow-up journey. What does that tend to look like?
So when I see patients for injection therapy, it can either be 1 or 2 sessions, really depending on the individual. Often a majority of men will do it in 1 session and they're fine with that. And then to titrate, again, I'm telling you that I'm a nurse practitioner, so I can titrate their dose. So I can, and titrating means I can increase it or I can decrease it. And I do that via email. So they can, or telephone call if you're not, I have some patients that can't use email or can't text and things like that. So I have my patient telephone that we talk to each other. And that's when the patients have tried a dose, and then they'll send back a response to me, and then I can titrate their dose either way. That way, having that connection, it's a very informal connection, but it gives patients access to me. So and it means that they can, we can troubleshoot it. And if I may need to call them and we might need to clarify or have a discussion about it and things. So it just gives the patients a bit of freedom to do that. And I think that that's important because it really is driven by them, and I'm just supporting them. So.
Yeah. Also helps with that, the fact that this is trial and error, and there probably will be troubleshooting along the way, so then to have an expert on board is fantastic. Now, one thing I definitely want to clarify, in that first appointment, Is it that you are giving them the first injection, or do they give themselves the first injection in the appointment setting?
So in my practice, I get the patient to do it. So they're supported by me. I'm in the room. We've gone through all the practical. I've given them an injection and a model that they can trial first, and then we go through that. Now, in the injection session, it's not about giving you a rigid erection that you're sort of walking out with this, massive erection. It's actually just a test dose. So it's really just showing you the technique and teaching you the technique so that you're safe to do that when you go home.
Great, good to clarify. I'm sure I get a lot of interesting YouTube comments if that wasn't clarified. I'm wondering as well, if a patient has a partner and the partner wants to be involved in the process, do you encourage the partner to come too?
Definitely. I definitely encourage partners to come, and I think that that's really important. There are some men that actually have a needle phobia, so they actually can't give the needle themselves, but their partner is very happy to learn. And so that way then the three of us will go through and do a teaching session together. So I think, again, it's very dependent on what the patient wants and the patient's needs, and then we try to adapt to that. So not everybody's the same. Everybody has a different way of learning and things, and I think having that flexibility makes it a little bit more less stressful when they go through this process.
Yeah, absolutely. I think the key here is you tailor.
Yes,
tailor
exactly.
is important.
Yeah.
And Kath, if somebody wants to come and have an appointment with you, do they need a referral for that from their doctor, or can they call you directly?
So I don't necessarily need a referral, being a nurse practitioner. However, we do like to get a little bit of a history as to, so whether they're coming in, often patients can give a good history, but as a nurse, we need a little bit of background behind that. So, what your surgery was like, how you recovered, and those sorts of things. So I think just a brief letter from the GP or something. I often get some from the country that will just refer patients in with the GP letter, but again, I don't need to have that. So
okay, fantastic. I'm going to put full details in the description box below on how you can contact Kath, because Kath, you work at a few locations.
Yes, that's correct. Yes.
So wonderful. Thank you so much for joining me.
No worries. Thank you.